My name is Babula, and I'm a primary care physician with Jefferson Internal Medicine Associates. So I've been working with the telehealth program for about the last year, trying to figure out how best to incorporate telehealth into the primary care and outpatient settings. We've been using telehealth in a variety of settings in our clinic with our nurse practitioner who does diabetes education, with our pharmacist who does a lot of medication education, with our nurse care manager who follows up on patients after the hospital stay has been using telehealth, and our primary care doctors have been using it to replace some of the in-person visits as well. So just the other day we had a telehealth visit with our nurse care manager who follows up on patients after they've left the hospital. And it was actually a visit with the nurse manager, myself, the patient who happened to be an 80-year-old patient with congestive heart failure who was at home, the home visiting nurse, as well as the patient's family member who lives in a different state. So we were able to get all of those people together on the phone call, on the telehealth visit in the patient's home to see how he was doing at home, what thoughts the visiting nurse had, and make sure that the family member was included in that conversation as well. So I think it was a very meaningful experience for everybody involved. The telehealth coordinators are essential to making our telehealth program actually function. The providers can't do this on their own. They're seeing patients back to back. They need help actually getting the patient set up ahead of time with the visit, getting set up with the technology, whether that's on their phone or their tablet or their laptop, and making sure that the visit is scheduled, and also making sure on the other end, after the visit has been completed, that the proper paperwork is completed and followed up on, whether that's for billing purposes or following up with the patient down the road. There's a lot of different things that occur at an office visit that are based on the fact that the patient actually physically comes to the office. So we check in the patient when they come into the office. We bring them back to the room after they've been checked in. They check out after they're done with their visit. None of those things really happen on a telehealth visit because it's all done remotely. So we need to change a lot of the pathways for patients as they move through the clinic and do that virtually. And that's what the telehealth coordinators are really essential at helping with. So we've learned that telehealth isn't for everything, and there's actually very specific use cases for telehealth that are best. We found that telehealth visits are on a spectrum somewhere between a telephone call and an in-person office visit. So a telehealth visit is easier than coming into the office, but a little more complicated than a telephone call. But we've also found that it's a little less useful than an in-office visit, but definitely more useful than a telephone call. We found that quick follow-up visits or visits that are specifically involved in education are really helpful. Other visits that are more complicated or with technical limitations don't work very well with telehealth. You can't examine a patient necessarily. You can't provide them with vaccines or do any kind of point-of-care testing that we would normally do in the clinic. And you can't give them prescriptions for things like narcotics, which require a hard copy of a prescription. So, eventually I think telehealth could be really great and useful in replacing the regular office visits with something that could be done more remotely, that could be done more conveniently for our patients. So rather than having to drive into Center City and park here and pay for parking and spend most of their afternoon going to a doctor's visit, they could just log on from home or work and see their doctor quickly. We'll also see telehealth visits used frequently for chronic care management in things like diabetes and hypertension and obesity, when we have patients use their blood pressure cuffs to send us remote readings, or use their scale to send us remote readings of their weight, or their glucometer to send us readings of their blood sugar so that we can help them to manage their chronic diseases. Telehealth is going to become the way of the future. More and more patients are going to start expecting it, and more providers are going to rely on it for quick follow-up type visits. I think it'll really be essential for how we continue primary care in the future.